Hi, I'm Vicki Wessling here with City Speaks. City Speaks is a show that's brought to you by Mayor Wilfred Rosas and the residents for the city of Dunkirk. And we're here today to talk about some important issues, one of which is our college kids. They're going off to school. They've left their little group from high school in most cases, and now they're entering college. And so we have with us today to talk about the college experience at Jamestown Community College and what they're doing. We have Dr. Daniel DeMart, our president of JCC, and Elizabeth Booth. Elizabeth is the director for the Jamestown Community College North Campus here in Dunkirk. So welcome to City Speaks.
Good afternoon, Vicki. Thank you for inviting Elizabeth and I to join you.
Well, we're happy to have you. You know, I have had a lot of questions, and a lot of people ask me things that are just out of the blue. But one of the things that has come up most recently is what kind of protocols are in place? How do you manage some of these things on the campus? So what are you doing? What is your plan?
Managing in terms of COVID-19 and the
Right.
pandemic has really been ongoing for us since mid-March. You know, since the day that we sent many of our employees home, we immediately kicked in efforts planning for fall. Mm-hmm. And a lot has changed since March when that planning began. And so we're now, we're down to the point where classes begin a week from today.
Right.
And making sure that all of that planning and time we've spent in preparation for fall, we're ready. Mm-hmm. And so there will be a lot of changes, and I'll just share some of them to give you a sense of how things are going to be different.
Okay.
First, the core message that we have said from the beginning is we want to make sure that we're providing a safe and healthy learning environment. And then from there, our core message is now wear a mask, mm-hmm. wash your hands, and keep a safe distance. So mm-hmm. anyone on campus this fall, especially if they're in a building, they need to wear a mask.
Now, if they're on campus but they're in a building, what if they're just walking through the park areas or
still have
the
to
green
respect
space?
the crowd. So as long as we're dispersed when we're outside, we're okay. But we do things outside in groups like Veterans Day, 9/11. So when we gather around the flagpole for a specific event, you need to have your mask on. It really depends on the gathering. But if you're just parking your car and you're walking to class, you need to have it on once you're in the building, as long as you're not close to other individuals.
So when you're outside and you can social distance, if you will, mm-hmm. It's okay. But once you get inside that building, it's got to come on.
It's got to come on. Mm-hmm.
Okay.
So that's a change. And one of the things we will do to help make sure people are doing this is mm-hmm. what we hope to do is have a greeter in each building that's going to be open, and not all buildings will be open. We'll have a greeter, and that greeter will ask 2 or 3 questions on your way in. And one will be making sure that you have a mask. And if you don't have a mask, we'll have some extras handy that we can give to you. So you've got to be wearing a mask once you're inside.
Okay, so, and one of the things that we talk about is certainly, as well as the mask and the social distancing, will they be doing the temperature checks?
When you enter any building, one of the first things you will see is a hand sanitizer station. So every entrance will have a hand sanitizer station, and you'll see things like, a sign attached to each one of them. And you'll see signs throughout campus that say various things, but reinforcing that message: wear a mask, keep a safe distance, wash your hands. So you'll see that as soon as you go in the door, and then you'll see it all throughout campus, in the classrooms, in the halls, with other signs. You'll see the greeter, you go off to your class. Before any student or employee comes to campus, they need to complete an app, an electronic form. And it will ask them 4 or 5 questions. One of them is temperature. Are you running a temperature? We're not going to be taking temperature checks. That's self-reported. Okay. And so these questions will be asked. It only takes a few seconds to complete the app. You submit the responses, and those responses will go to our health centers. And then our health centers, who know how to handle HIPAA data and responses depending on how a student or employee answers those questions, will know if anything needs to happen beyond that. Now, when the app is completed, it will send a message appropriately, and the sender will also get a message that will say, you're cleared to go onto campus. And we'll
Okay.
ask to see that. Did you complete the app? And they can simply show, yes, I did. If they don't have a phone or access to technology, we'll have paper versions that they can fill out when they walk in the door.
So it's hard to believe that people wouldn't have today, but in some cases they don't, I
Well,
guess.
if you go back to March, when we had to make the sudden shift, with all of our classes at a distance, which was a question of volume for us. It wasn't new. We've been teaching online for 20 years, so we had that down pretty well. But to shift everything in that mode, or almost everything, one of the things we learned, and it wasn't a surprise, is not all students had the technology. And so we would, where we could, provide them laptops. We took cell phones and set up hotspots so they could finish their courses online from wherever they were. Well, that scenario hasn't completely changed between March and now August. So we have acquired additional laptops, and we're able to help students who need
Now,
access.
so will you be doing virtual as well as in-class instruction?
We will. So the way we've laid out the class schedule is we will offer some courses on campus. Most courses will be offered at a distance, and then there are various combinations of those two. The students who are in the courses that can only be offered on campus, they will start with us Monday, and our goal is for them to finish what needs to be finished on campus by Thanksgiving.
Okay, so that's Monday the 24th.
That's right.
They'll be started.
And assuming that there's a second wave, we don't want any of our students or employees to be exposed. So we'll wrap up all on-campus activity by Thanksgiving.
Okay, and so now we talk about the Hillside Suites in Jamestown. So what are we doing there with our students? What kind of protocols are they following to be a resident there at Hillside Suites?
So some I've already described with the app. Residence hall students will need to complete that app every morning before they leave the building. And then we have lots of additional protocols in place. We have residence assistants and residence hall directors. They will be on hand to make sure that protocols are being followed, whether it's the app or any of the other social distancing aspects that we've built into the agreement this fall.
Okay.
We were fortunate to learn some of the adjustments we needed to make wrapping up the spring semester. So even though we made this pivot in mid-March, we still had several students who were with us through the end of the semester, most of them international who couldn't make it home. We were fortunate that we learned from that time frame between sending almost everyone home in mid-March to the end, the kinds of things we really needed to know in planning for fall.
Now, let me ask you a question. When we have our students who are there and they're in the residence hall, and they maybe have a shared room with 3 other students, do those students stay like in a pod group where they're on the same curriculum track, or do they just disperse to their own?
We don't group them in terms of program and where their interests are. It's more of on the way in. They describe themselves and the kind of person that they would like to room with, and then we try to make that match.
Okay.
Once they're there, they're off taking their own classes and programs.
Okay.
But one of the protocol pieces to this is they'll be in a suite. We don't have pods.
Okay.
And so roughly 4 students to a suite that will share bathroom, bedrooms. If we get a reported case of COVID, we will isolate a student to his or her bedroom, to 1 bathroom, and then we'll quarantine the other 3 and work through the situation.
Okay. Now that brings up a question. If we do that, and what about their classes? Then will all of their classes then automatically become remote and virtual?
Yes,
I mean,
except for those classes that can only be finished in person.
so if they're quarantined, what happens?
Well, here's what happened in the spring. We had roughly 130 students that were in welding and HVAC and nursing and occupational therapy that weren't able to finish. We had to stop those courses. There is no online version of welding, right?
Right.
And what happened was we gave most of them incompletes, and then we brought them back and helped them finish. Actually, Elizabeth and her team were instrumental in helping us figure that out, which was also very fortunate for us in preparation for fall. I don't know if you want to describe what that looked like with those courses and those students?
Sure. So we had students both here and in Cattaraugus County, particularly HVAC was the one I was working on. We also had we had numerous classes, both credit and non-credit, and we brought them back. We took great care in making sure that every aspect of the process of bringing the students on campus and delivering the course content was done safely. It was quite a bit of work. As Daniel was mentioning earlier, it was easy for us, I mean, not easy, but it was a quick move to get us to all go home, but boy, the process of bringing people back requires a lot of thought. I also serve on we have a couple of different teams. One is the reopening team on the operations side. So I'm familiar with that part of what we've been doing as a college, and it is very complex. We've been really focused on following the New York State guidelines, and in every case we meet or exceed those guidelines.
What kind of feedback have you gotten from staff? Have you lost staff as a result of this, where they've said, "Wait a minute, I don't want to do that. I don't want to be in the classroom"?
Our employees, both faculty and staff, they've been tremendous throughout this. You know, and I've shared this recently, where I would put out a call to help because we needed help on something specific in preparation for fall. And the response was quick and it was overwhelming. Yeah. That's not to say there isn't some concern out there, but what we've done in the operations plan that Elizabeth is talking about is we're trying to be as flexible as we can. You know, we will at most have a third of our students on campus, and it will be roughly a third of our employees on campus. One of the reasons why we wouldn't bring back and can't bring back all employees, even if we wanted to, is because we don't know yet for certain what's going to happen with the schools.
Right.
Right, so what we don't want to do is create another problem by telling all of our employees they need to be back to work, but have them worrying about child care and what's happening with school. So we've built in, I think, as much flexibility as we can, recognizing the situation for what it is, and at the same time balance that in helping us get through fall with providing students as much a normal experience as we can. Now, one more thing on the protocol and what Elizabeth described with those summer students. That experience resulted in helping us figure out that what we're going to be providing every student and every employee is a PPE kit. And in that kit, everyone will get a couple of disposable masks, they'll get a couple of cloth masks, and they'll get some hand sanitizer. And if they run out, we'll help resupply.
Okay, that's great. So then you'll actually take on part of the responsibility, or you'll share the responsibility for making that happen. What kind of feedback have you gotten from your parents of the students?
You know, it's a little too early for us to get feedback on fall semester because we haven't started yet. Now, we have gotten a couple of calls, and one in particular was concerned about her son who wants to play on one of the teams, on what things are going to look like in fall. The result of that one conversation is we will, every other week, hold a specific Zoom session for parents. Okay. So if there are any concerned parents and they want to know what's going on, how are things going on campus, what's happening in the residence halls, we'll provide that opportunity to engage with us and help answer those questions.
Okay, so at least the parents will be constantly updated. They'll know what's happening with their students. Now, we talk about if they're in the residence hall in their suites. What about visitors? Will visitors be allowed to come in and?
Go ahead.
We are not allowing visitors on campus, which it'll be an adjustment for students, but it is the safe and right thing to do.
Right.
And we're not unusual in that regard, Vicki. When we look around other colleges, they have a very strict visitor policy.
Right. So, and that's important too, and that's something that the parents want to know as well. You know, we don't want anybody bringing anything in. You also have done some really remarkable things as far as absolutely like foreseeing some of the issues that may be coming up. I know that you've made some budget cuts. You've been kind of prepared for this financially. Tell me a little bit about what you've done, how you've been proactive in this area.
I don't know how you prepare for this financially, but we've responded I think in a very comprehensive way, which has been, I don't know, it's been remarkable, really. You know, last year we had to cut $1 million out of our operating budget. Not expecting that that would happen again this year, a combination of decisions in Albany and COVID resulted in us having to cut $4 million from our budget. So 4 times the size of what we cut out last year, we had to take out this year in preparation for what we foresee coming with enrollments and just in general with response to COVID. And, you know, the approach we've taken has been comprehensive. I can't think of a thing we didn't look at, examine, talk through in figuring out how do we close this budget and do it in a way where we're preserving the core mission and minimizing the extent that we can the impact on our staff. And it's taken a tremendous amount of work. You know, it wasn't going to be possible with that size of a deficit that it wouldn't impact employees, but our employees stepped up in a big way, recognizing that this problem was a big problem and that if we shared in the burden, we'd all get through it a little bit easier.
Well, you know, and I have my heart with JCC. I mean, I love it. I think that it's a great campus, and of course, in the Dunkirk campus, you're doing some things there also. And has enrollment been impacted negatively at the Dunkirk campus?
Well, interestingly, we've had to move, as Dr. DeMart was saying, we've had to move most of our classes online or live Zoom or into a different format. We have a limited number of classes that are taking place on site. So our enrollment really, a student could be taking those flexible classes or the online classes from any of our sites.
Okay.
So it's a little more challenging now to tease out the Dunkirk specific enrollment. But we're hoping that people will come to college. I mean, we've talked a lot about kind of the traditional student, those that are graduating from high school. A large portion of our students at the North County Center are adult learners, as you know. So in that age group, 25 and older.
Right.
And you know, we're trying to address the needs of those learners as well. Of course, as we were talking about earlier, what is happening with the schools will make a big difference.
Right.
Many times these are individuals with children at home or working full-time and coming to college at night. And childcare, when we survey our adult learners, is always at the top of the list of a concern.
Okay.
And we should add that College Connections will run as it normally would.
Okay, now tell me a little bit, remind me a little bit about what College Connections, let's talk about that.
Yeah.
We have a long history of offering dual enrollment programs in the high schools, and we're in almost all of the high schools in Chautauqua and Cattaraugus County, and we're in a few in Allegheny County. So we have, this last year is a good example, close to 2,000 students who are taking one course or more with us while they're in high school, taking a college course that gives them credit for both their high school requirements and college. They too had to make the shift in March, and we will provide the support if they need support in using the tools that we have or training or whatever else they need. And I think they've got pretty good support now anyway. But the point is we expect that this fall semester will carry on at a distance and offer, be in a position to offer what we would normally just at a distance.
Right. You know, and having, with some of our seniors in high school, this is great to be able to take the college classes as well,
Yes.
and then come out and be a little bit more prepared. The other thing that Jamestown Community College does, you work with Fredonia State or other four-year colleges so that they can actually participate with the college, with the bigger college experience, and yet take the JCC courses, right?
Yes, although that will be a little bit trickier this fall. We each have
I'm
our
sure.
own protocols, and so some of those conversations may get put on hold until we get through the pandemic.
Right.
And then in Fredonia, there's a new president who's here.
Right.
I'm excited to be working with him. I think there's opportunity for us to partner in new and creative ways that we haven't, especially now. And back to a point Elizabeth made earlier, one of the positive outcomes of what's going on with the pandemic is we've gotten even better at how we use our technology. When we get to the other side of this, to the point on adult learners, I think we will have learned how to reach them in more creative ways that will fit their lives, their schedules, much better than what we were doing. And it was all right before, but much better coming out of the pandemic.
Right. I think so, and I see so much of that happening, that adults now are kind of forced to learn a little bit more about the technology, so it's a very good thing. What other kinds of things are happening? What other kinds of things do we need to talk about? What do you want parents to know that they may be asking questions that I have not asked already? And our students?
Well, we have the COVID-19 webpage where we keep it regularly updated.
And how would they access that?
If they go to the sunyjcc.edu,
Okay,
they get to our homepage.
sunyjcc.edu.
They will see right when they get to that first page, they'll see links for COVID-19 at JCC. Just click on them and they'll take them through a wealth of information about fall and the protocols that we're following. And yes.
Okay.
It's an excellent resource, and I'll add that we are still doing all of those other things that go along with what happens in the classroom. So our counseling center is active. Students can meet with their advisors. They can get tutoring. We've devised ways to deliver all of those same services in a remote fashion, in some cases face-to-face.
Okay.
And for those students who will be on campus this fall, we're ready. We've got the protocols in place that we'll keep students, we'll keep our employees safe, we'll keep things clean, disinfected. We're ready to go.
All right. Okay, and so your sanitation staff or your housekeeping staff, they've got everything.
Oh yes.
So they're set.
They are on this.
Yeah.
Yes.
Is there anything else that you need to show, that you need to talk about before we
I think we've
covered it? Okay. All right. So if you want to have if you have a student, and can they still enroll?
Absolutely.
Yes.
Yes.
So they can still enroll.
Yes.
There's still classes. Okay,
Yes.
that's great.
We're ready for you. Come to JCC.
And it's not too early to get started for a January start time as well.
Right. So if you maybe can't get to it this semester, go ahead and enroll for January.
And if you don't mind, I'll add also that we have a workforce readiness division. So in addition to our credit side classes, our workforce readiness division is also prepared to deliver non-credit, workforce ready, credential-based training. And we've actually introduced a new series of online trainings in a variety of in-demand occupation areas, including healthcare and IT and business. So those are available as well.
And they would get those by going to sunyjcc.edu, right?
And search workforce readiness.
Okay, there you go. So you've
Yeah.
got that as well. Thank you so much. I know
Great.
it's been short. I know you've done a fantastic job, because I keep hearing about what you've done. So I know you've done a fantastic job since all of this happened. And I look forward to seeing you again, and hopefully things will calm down and this COVID will go away. maybe it will pass. Thank you for being here. Thank you, Dr.
Thank
DeMart.
you.
I really appreciate it. Thank you, Elizabeth. Thank you so much for all you do for our students. JCC is the place to go. I strongly recommend it. It's great. So, and thank you for watching City Speaks. You can watch City Speaks daily on Spectrum 1301 in Dunkirk. Catch us anytime at your leisure by going to dunkirkaccess.com. Watch it on YouTube. Let me know what you think. Let me know what you like. Send your email, your comments, your questions to cityspeaks@cityofdunkirk.com. Snail mail, City Speaks, 342 Central Avenue, Dunkirk 14048. We're here for the residents for the city of Dunkirk. Thank you so much for watching City Speaks, and have a great day.